We now come to matters to be raised before the forthcoming adjournment. I now call Mr David Amess to move, and the usual procedure of 10 to 15 minutes. David Amess.
To move the motion standing in my name on behalf of the Backbench Business Committee as on the order paper. Mr Deputy Speaker, there are a number of issues I wish to raise before the Easter Adjournment Debate, and I would try and get through them as quickly as possible so that the 16 members who wish to speak, we all have equal time. I was on the Health Select Committee for 10 years, and there are still a number of health issues which I'm very interested in. And one is to do with a genetic condition that causes high concentrations of cholesterol in the blood and therefore significantly increases the risk of developing coronary heart disease from a young age. It's known as FH. It affects 1 in 500 people, but only 15% have been formally identified or treated. However, it is possible to make improvements in this rate, and I'm asking the Deputy Leader of the House to pass on to the Health Department that the cardiovascular disease outcome strategy for England, which includes an aspiration to diagnose and treat 50% of causes of FH, would actually consider establishing a national programme for FH that features a dedicated network of healthcare professionals. Nurses could roll out the Cascade screening process and a UK-wide patient register and database be established. Now, melanoma cancer is something that all members of Parliament are only too well aware of, and I recently had the privilege of meeting Jill Nuttall, who started the charity Melanoma UK. It is the most serious form of skin cancer, and each year over 2,000 people in the UK actually die from the disease. This disease disproportionately affects young people, and patients are often of working age with young families. It's absolutely devastating. Decarbonazine, which is the present treatment, doesn't really have a high survival benefit. So I'm asking the Shadow Leader of the House to pass on to the relevant department that the drug Ipilimumab, which can be life-saving treatment for some patients and their survival is inhibited by later access to this treatment. On the 23rd of April, I'm invited that the National Institute for Clinical Excellence Appraisal Committee will hold its second meeting to give a recommendation about this particular drug, and I do hope that it's approved. I'm the chairman of the APPG for Hepatology. And we recently produced what I'm brazenly about to say was an excellent report into liver disease. It's called Liver Disease, Today's Complacency, Tomorrow's Catastrophe. It's about improving outcomes in liver disease and is a wake-up call to the nation, because I don't know, Mr Deputy Speaker, how many people realise, but it's the 5th greatest cause of death in the United Kingdom. About 11,000 people die each year as a result of this particular problem. So the report made many recommendations, and I do hope the government, the NHS and the Public Health England will work together to create a national approach to preventing the fatalities that we have from liver disease, and a meeting with the Minister responsible for public health would also be extremely useful. Drug treatment strategy is something that I think interests us all. National guidance from the Department of Health and the National Institute for Clinical Excellence is clear in recommending that all patients treated by opiate addiction receive a comprehensive assessment and that the treatment provided is tailored to their needs. Yet, according to the results of the largest survey ever carried out in drug addiction across 10 European countries published in 2012, it indicates that treatment in the UK may often not be optimised to the individual patient's needs. We have one of the highest levels of heroin addiction in this country. So again, I would hope that the Department of Health will work with the National Institute of Clinical Excellence Technology Appraisal on Drug Treatment Options TA114 to see that it's implemented and that a monitoring system is in place to ensure that every patient is assessed and offers the safest and best treatment to enable them to recover. Now, thalidomide used to be something that was mentioned regularly in this House. Recently, I was shocked to learn that justice has still not been served after all these years, and probably most members of Parliament may still have 1 or 2 thalidomide victims in their constituencies. In cases where pharmaceutical company Grünenthal were not the licensee, thalidomide victims didn't receive a penny from either the German government or the manufacturers. In other European countries where thalidomide was marketed, the victims have received financial assistance from Grünenthal and the German government. So what I'm asking is that our government turns to exploratory talks into formal negotiations to assist the funding of the health needs of those who suffer from thalidomide. Italian, Swedish and Spanish MPs are asking their governments to do likewise, and I hope that our government will take this matter seriously. I'm the chairman of the all-party parliamentary group for maternity. I was totally unaware of tongue tie in breastfeeding. Breastfeeding, as we all know, if the mothers can do it, is the best possible way to nurture children. But this issue of tongue tie is a very upsetting one for new mothers. It's not fully recognised a diagnosis. However, when it is discovered early on, treatment is usually quick and straightforward. A specialist can perform, so I'm advised, a very simple snip of the tie with scissors, often without even needing an anaesthetic. The National Childbirth Trust has received communication from many mothers describing their experience of tongue tie, and it seems to be an issue that needs to be addressed. They are concerned that diagnosis of tongue tie can sometimes take weeks or months. Very, very upsetting for a new mother. So I quote from one mother: "Both my children were tongue-tied, and in both cases the professionals failed to identify it due to unacceptable waiting times. I felt I had no option but to pay for private tongue-tie division. I went to hell and back on my feeding journeys because of tongue-tie." So I do think this is something that we need to improve. Gender selection abortions. Many years ago, I can remember debates in this House on the matter, and I was reassured by whoever was the then minister that this wouldn't happen. But unfortunately, 4,700 girls were missing in the UK due to sex selection abortion. Absolutely disgraceful. And there's a growing body of anecdotal evidence proving that gender abortions are really taking place in this country, despite reassurances many years ago that this wouldn't happen. There is, I believe, a need to clarify the law on sex selection. The Department of Health interprets the law to say sex selection abortion is illegal. The head of the British Pregnancy Advisory Service says the opposite. The Abortion Act requires 2 doctors who can deal with the form in good faith to say that they are the opinion that continuing with the pregnancy risks damaging the mental or physical health of the mother. In a situation where a woman might suffer abuse as a result of bearing a child, as unfortunately has been the case in some minority communities, it is quite conceivable that sex selection abortion would meet the criteria of the Act. So again, I say to the Deputy Leader of the House, I do hope the Department of Health proposes non-binding guidance to solve this problem, and that just isn't good enough. I want the Secretary of State for Health to consider bringing forward regulations under the powers conferred on him by Section 2 of the Abortion Act to make gender abortion explicitly illegal, as we were told many years ago. Now, assisted dying is something that regularly rears its head, perhaps not in this chamber, but in the other place. And all I'm asking that when it comes to this matter being raised again, there will be a genuine free vote on this issue in the House. The Prime Minister certainly touched on the issue of abortion yesterday, but I do hope in terms of euthanasia, there will be a genuine free vote on the issue. I raised in Westminster Hall, Mr Deputy Speaker, I think it was over a month ago, the great grave concerns I had about the mental health services provided in South East Essex. I told the then Minister, the Minister for State, that I was totally unhappy with the past management and the present management, and he promised me a meeting. Well, it's a month. I'm ready. I do hope that the Deputy Leader will make sure that his right honourable friend makes arrangement for me to have the meeting with him very quickly, because the complaints are endless. Now, I'm very pleased that we're going to reform the probation service in this country, but I was absolutely horrified to learn that apparently, for instance, in the area that I'm in of Essex, I've been very, very critical of the probation service, and I'm horrified to learn that the same people running the probation service, that is the chief executive, are thinking of reinventing themselves under the auspices of a mutual. Well, certainly as far as a Member of Parliament for Southend West is concerned, there's no point changing the probation service unless it's under new management. Turning very quickly to foreign affairs, I was privileged to be involved in a delegation to Saudi Arabia, and we're going to have a meeting with the Foreign Office Minister later this afternoon. I found it very interesting the way that our relations with Saudi Arabia have developed. They have certainly been a very, very reliable ally of ours for over 100 years. But I did think there are some perhaps trade opportunities that we're missing out on, but I do hope that the Foreign Secretary will continue to nurture good relations with Saudi Arabia. I'm the chairman of the all-party parliamentary group for the Maldives, and at long last we have a settled president after some controversy regarding the election. And I very much hope that we will facilitate a double taxation treaty and a bilateral investment treaty which will reduce the air passenger duty and also make student visa applications more accessible for young talented students from the Maldives to travel here to study at our excellent academic institutions. I certainly feel, Mr Deputy Speaker, we could do more to encourage business links between our two countries. After all, they were a British protectorate. The British High Commissioner, John Rankin, has agreed to visit the Global Green City project, a fantastic project that aims to create a safe, serene and spacious environment with huge economic potentials for the citizens of Maldives. And I just want British businesses to enjoy some of the business opportunities there are there. Now, I recently became chairman of the all-party parliamentary group for democracy in Bahrain, a very, very controversial all-party parliamentary group that I hadn't initially realised was such, and I would just say that I do hope that the government is looking very seriously at the further complaints there are about torture. Quilliam is an organisation which deals with online extremism. And last month, I was reunited with a former constituent called Majid Nawaz, who I last saw when I visited him in an Egyptian prison some 10 years ago. Now, he's been on an incredible journey. Having been a former member of an Islamist revolutionary group and spending 5 years in a prison in Cairo, which was a little bit like Midnight Express, he then had a complete change of heart and transformed his life and started the anti-extremism organisation Quilliam. Quilliam have just finished the most comprehensive report to date on online extremism, and it will be published shortly. The issue was raised in the counter-extremism task force set up after the Woolwich attack, and therefore I think it is important that we consider this issue very carefully. Quilliam's research has found that negative measures of dealing with online extremism, such as blocking or censoring, had previously been suggested would be both ineffective and counterproductive. They instead identify 7 other ways that action would be taken to counter online extremism, including the promotion of positive measures such as developing counter-extremist content and popularising online initiatives that fight against extremism, as they are much more effective in challenging extremist ideologies, and the establishment of a central body that offers seed funding and training for grassroots online counter-extremism initiatives. And when we went to Saudi Arabia, we visited a facility there where they were trying to de-radicalise people. So I absolutely say to honourable members in all parts of the House, do, if you have the chance, I hope you will have a look at the views of Quilliam. Now, my constituent went to Westcliff High School for boys, and I'm delighted to say that Westcliff High School for girls has been judged to be the second best school in the country, and it's a state school. In March, I visited CTEC and met some of the staff of one of the United Kingdom's major providers of training and employment. They do an absolutely wonderful job. They've been founded for 30 years, and I do congratulate them on all that they have done. I, like many people, are not very pleased with the work of spy cars. I absolutely support the Secretary of State for Communities and Local Governments in his endeavours to get them scrapped. And my last but one topic is that of wine and spirits industry. Very pleased with what the Chancellor of the Exchequer did in the budget. Wine duty, however, has already increased by 54% since the escalator was introduced in 2008. It's now been increased by another 2.4% in line with RPI inflation. I think this will harm the United Kingdom, so I do hope the Chancellor next year will have a look at that duty. And my final subject, Mr Deputy Speaker, is puppy farming. I know that there is a bid in front of the Backbench Business Committee for a debate on the issue. There's going to be a mass gathering of people who feel very angry about puppy farming in June. So I do urge the government to tighten up the legislation on the welfare conditions currently required to allow the sale of puppies and kittens, and consider a total ban of their sale in pet shops where the mother is not present. I finally wish you, Mr Deputy Speaker, and everyone who supports us in this House and outside a very happy Easter.